Okay, and welcome all you infidels, kuffar and Muslims out there. Nemesis is back, and I'm obviously going to elaborate a little bit more on Muhammad being a paedophile and Sharia law allowing Muslim men to fuck children. So, what I'm going to do first is I'm going to go to Medem, which is a site that sponsors, or is at least partly sponsored by, the American Psychiatric Association. And what I'm going to do is I'm going to read to you now their diagnostic criteria for paedophilia. So, paedophilia included in the American Psychiatric Association Diagnostic and Statistical Manual of Mental Disorders, DSM, since 1968 continues to be classified as a mental disorder. The DSM is the standard classification of mental disorders used by mental health professionals and provides clear, objective descriptions of mental illnesses based upon scientific research. Paedophilia is categorized in the DSM IVTR as one of several paraphilic mental disorders. The essential features of a paraphilia are recurrent, intense sexually arousing fantasies, sexual urges or behaviors that are generally involve non-human subjects, children or other non-consenting adults, or the suffering or humiliation of oneself or one's partner. An adult who engages in sexual activity with a child is performing a criminal and immoral act, and this is never considered normal or socially acceptable behaviour. Darrell A. Reiger, MD, MPH, Director of the American Psychiatric Association's Division of Research, states, "There are no plans or processes set up that would lead to the removal of the paraphilias from their consideration as legitimate mental disorders. The American Psychiatric Association Diagnostic and Statistical Manual of Mental Disorders, 4th edition, text revision, DSM-IVTR, criteria for paedophilia 302.2 are this. A. Over a period of at least 6 months, recurrent, intense, sexually arousing fantasies, sexual urges or behaviours involving sexual activity with a prepubescent child or children generally aged 13 years or younger." I'm sorry, I had to emphasise those parts. B. The person has acted on these sexual urges, or the sexual urges or fantasies cause marked distress or interpersonal difficulty. And C. The person is at least age 16 years and at least 5 years older than the child or children in criterion A. Paedophilia generally is treated with cognitive behavioural therapy. The therapy may be prescribed alone or in combination with medication. Some examples of medications that have been used include anti-androgens and selective serotonin reuptake inhibitors, SSRIs. Relapse prevention is also emphasised. However, the outlook for successful treatment and rehabilitation of individuals with paedophilia is guarded. That's very clear, people. That's very, very clear indeed. Right, what I'm going to do is I'm also going to go on about puberty now, because this is very, very relevant. I've gone to an encyclopedic source here, and puberty is defined in stages. So I'll just read this to you as well. Puberty has been divided into 5 sexually maturing ratings, SMR, stages by 2 doctors, W. Marshall and J.M. Tanner. These ratings are often referred to as Tanner stages, 1 through 5. Staging is based on pubic hair growth, on genital development and female breast development. Staging helps determine whether development is normal for a given age. Both sexes also grow armpit hair and develop pimples. Males develop muscle mass, a deeper voice and facial hair. Females redistribute body fat along with the maturing of the sex organs. There is pronounced growth spurt averaging 3 to 4 inches, 8 to 10 centimetres and culminating in full adult stature. Puberty can be early or delayed. So I'm going to go on about puberty stages in girls. This is very relevant to the argument. So stage 1, and that's approximately between the ages of 8 and 11. The ovaries enlarge and hormone production starts, but external development is not yet visible. Stage 2, approximately between the ages of 8 and 14. The first external sign of puberty is usually breast development. At first, breast buds develop. The nipples will be tender and elevated. The area around the nipple will increase in size. The first stage of pubic hair may also be present at this time. It may be coarse and curly or fine and straight. Height and weight increase at this time. The body gets rounder and curvier. Stage 3. Approximately between the ages of 9 and 15. Breast growth continues and pubic hair gets coarser and darker. Continuing this stage, whitish discharge from the vagina may be present. For some girls, this is the time that the first menstrual period begins. Stage 4. This is very appropriate to my argument later on, but stage 4. Approximately from ages 10 to 16. Some girls notice that their aureoles, forgive my pronunciation, aureoles get even darker and separate into a little mound rising above the rest of the breast. Pubic hair may begin to have a more adult triangular pattern of growth. If it did not happen in stage 3, menarche, first menstruation, should start now. Ovulation may start now too, but it will not necessarily occur on a regular basis. It is possible to have regular periods even if ovulation does not occur every month. And stage 5, approximately between the ages of 12 and 19. This is the final stage of development. Full height is reached and young women are ovulating regularly. Pubic hair is filled in and the breasts are developed fully for the body. Right, that again can't be any clearer. Right, puberty is defined in stages. Right, just because someone hits puberty or starts puberty does not mean that it's absolute or that it's complete. Puberty is not absolute until its completion, and obviously stage 5 determines that. So what I'm going to do now is going to go on to Naliakbars' channel. This is the person who I've basically introduced to this argument that Muhammad is a paedophile and that Sharia law allows Muslim men to fuck children. So right, here we go. I've just asked him that question, and then he wants me to say if I believe in God or not. Yes, I do. Great, and now that he knows that I can believe in God, he's going to start the topic of debate, which is grand. He's going to actually defend his faith now for me. He's actually said that Islam does not allow for penetration of a 9-year-old. Right, it's very clear, it's here, look. Islam does not allow for penetration of a 9-year-old. It allows penetration of a woman who has arrived at puberty. So she can be at 9 or 19. You can't penetrate her until she has arrived at the age of puberty. If this was wrong, then God made a serious flaw in their design, because my great-grandmother was pregnant at that age. Right. Obviously we're having this discussion on mine and his page as well. It's much easier for me to follow it on his page because he's got less comments on his. So I've welcomed him to my page, and I've also mentioned here I wanted to know what the age of his great-grandfather was, because he's brought his great-grandmother in as some kind of justification for having sexual intercourse with a young woman or a girl, as I certainly define it. Secondly, you mentioned that the age of 9 is not the earliest age for which a girl can be penetrated, because you say it's when she arrives at puberty. So can a girl who is younger than 9 years of age have sexual intercourse with a Muslim men? And also, how do you view Sharia? Is it a good way to lead life by following Sharia? Regards. Very simple questions requiring very simple answers. Let's see how we get on, shall we? Page 10. And right, he just wants to go on about keeping the debate logical, and about we're talking about two different things, and he hopes that I understand that. I started off by saying, he says that I started off by saying, in my opinion, that it was wrong. He started saying that it was God that allows women to bear children from the age of puberty, and therefore she is ready for marriage. One of the purposes of marriage is to procreate, so it's a sign that a woman is ready for consummating her marriage, which can lead to procreation. And I hope I'm clear about puberty and not menstruating, because outside of the periods there are other things involved with puberty, like the darkening of the hair, etc. Well, he seems very reasonable at the moment, but I'll leave that with you, and I'll come back to you in just a minute for part 2.